Avoid oats if you are on these medications. Oats have long been hailed as a superfood, packed with nutrients that offer numerous health benefits. From their rich fiber content to their ability to lower cholesterol and stabilize blood sugar, oats have become a staple in the diets of health-conscious individuals worldwide. But while oats are undoubtedly a healthy choice for many, there's a lesser-known side to this popular grain, one that could spell trouble for those on certain medications. Consider the story of Emily, a 55-year-old woman who had been enjoying her daily bowl of oatmeal for years. After being diagnosed with high cholesterol, she started taking statins as prescribed by her doctor. However, despite her efforts to eat healthily and take her medication as directed, Emily found that her cholesterol levels weren't improving as expected. Confused and concerned, she sought advice from her doctor, only to discover that her beloved oats might be interfering with her medication. Emily's story is not unique. While oats are generally considered a heart-healthy food, they can interact with certain medications in ways that may reduce their effectiveness, or even cause harm. Whether you're taking blood thinners, diabetes medications, or thyroid hormones, it's crucial to understand how oats can impact your treatment plan. In this video, we'll dive deep into the surprising ways oats can interact with various medications, potentially putting your health at risk. We'll explore the science behind these interactions, discuss the potential dangers, and offer practical advice on how to safely enjoy oats without compromising your health. So if you're currently on medication or considering starting one, this is a must-watch video. Let's uncover the truth about oats and medication and ensure you're making the best choices for your health. If you find this video helpful, please like, comment, and subscribe for more content that supports your health journey. Let's get started. Number 1. Blood thinners. If you're on blood thinners like warfarin, maintaining a delicate balance in your diet is crucial. Warfarin is prescribed to prevent blood clots, which can lead to serious conditions such as strokes or heart attacks. The effectiveness of warfarin hinges on a consistent intake of vitamin K, a nutrient involved in blood clotting. However, consuming oats can potentially interfere with the stability of your blood-thinning regimen, which is something many people aren't aware of. Oats are high in fiber, specifically beta-glucan, which is excellent for heart health. Beta-glucan helps lower cholesterol levels and improves digestion. However, the same fiber that makes oats so beneficial can also pose a risk for those on warfarin. Fiber-rich foods like oats can bind to medications in the digestive tract, potentially reducing the amount of medication absorbed by your body. This reduced absorption could lead to lower levels of warfarin in your bloodstream, making it less effective at preventing blood clots. Moreover, oats contain small amounts of vitamin K, and while they aren't as rich in this vitamin as leafy greens, regular consumption can still contribute to fluctuations in vitamin K levels. For individuals on warfarin, even minor changes in vitamin K intake can alter how the drug works, leading to either an increased risk of bleeding or a decreased effectiveness in preventing clots. Consider the case of Daniel, a 60-year-old on warfarin. He was diligent about taking his medication, but continued his daily habit of eating a big bowl of oatmeal. Despite adhering to his medication schedule, he experienced unexpected blood clots. His doctor later explained that the interaction between his diet and medication could have been a contributing factor. The fiber in the oats may have reduced the absorption of warfarin, compromising its efficacy. Number 2. Diabetes medications. If you're managing diabetes with medications like insulin or metformin, incorporating oats into your diet might seem like a healthy choice. Oats are often praised for their low glycemic index, GI, which means they cause a slower rise in blood sugar levels compared to other carbohydrates. However, the impact of oats on blood sugar control isn't as straightforward as it might appear, particularly for those on diabetes medications. Oats, while a whole grain and rich in soluble fiber, can still affect blood sugar levels, especially when consumed in large quantities or in processed forms. The fiber in oats, specifically beta-glucan, helps slow down the digestion and absorption of carbohydrates, which can lead to more stable blood sugar levels. However, for individuals on diabetes medications, this slower digestion can sometimes lead to unexpected blood sugar fluctuations. For example, when consumed alongside insulin or metformin, The gradual release of glucose from oats can cause a delayed spike in blood sugar levels. This delayed response can be problematic for those managing their glucose levels with medication. If the timing of medication and the absorption of glucose don't align, it could result in either hyperglycemia, high blood sugar, or hypoglycemia, low blood sugar, both of which are dangerous. Consider the story of Mary, a 55-year-old diabetic who was prescribed metformin to manage her blood sugar levels. Mary started eating oatmeal for breakfast, thinking it was a healthier option. She noticed that her blood sugar levels were difficult to control throughout the day, with unexpected highs and lows. After discussing her diet with her doctor, it became clear that the oats were affecting her blood sugar levels differently than expected, particularly in the context of her medication schedule. Number 3. Cholesterol-lowering drugs. Oats are often celebrated for their heart-healthy benefits, particularly their ability to lower cholesterol levels. Rich in soluble fiber, specifically beta-glucan, oats can help reduce the absorption of cholesterol into the bloodstream, making them a go-to breakfast choice for those looking to manage their cholesterol levels naturally. However, if you're taking cholesterol-lowering medications like statins, you might need to reconsider how oats fit into your diet. Statins such as atorvastatin, Lipitor, or simvastatin, Zocor, are prescribed to help reduce levels of low-density lipoprotein, LDL cholesterol, often referred to as bad cholesterol. These medications work by inhibiting an enzyme in the liver responsible for producing cholesterol, thus lowering the overall cholesterol levels in the body. While oats also target cholesterol, they do so in a different manner, by binding to cholesterol in the digestive tract and preventing its absorption. On the surface, it might seem like combining oats with statins would provide a double benefit for lowering cholesterol. However, the interaction between these two cholesterol-lowering strategies isn't always synergistic and can sometimes complicate cholesterol management. For instance, consuming large amounts of oats may lead some individuals to unintentionally decrease their reliance on statins or alter their medication regimen without consulting their healthcare provider. This can be problematic, as the effectiveness of statins can be compromised if the dosage is not carefully managed. Additionally, the high fiber content in oats can interfere with the absorption of statins, particularly if the medication is taken around the same time as an oat-rich meal. This reduced absorption can lessen the drug's effectiveness, potentially leading to higher cholesterol levels over time. Consider the case of John, a 60-year-old man who was prescribed statins to manage his high cholesterol. John, eager to lower his cholesterol through diet, began eating oats every morning for breakfast. Over time, he noticed that his cholesterol levels were not dropping as expected, despite his consistent oat consumption and adherence to his statin prescription. After a discussion with his doctor, it became clear that the timing of his oat intake was affecting the absorption of his statin medication, reducing its effectiveness. Before we move on to the next important point, I want to take a quick moment to remind you to subscribe to our channel. It really supports our work and allows us to continue bringing you valuable information. So, if you haven't already, hit that subscribe button so you don't miss out on anything. Now, let's dive into the next point. Number 4. Thyroid medications. Thyroid medications like levothyroxine are vital for those managing hypothyroidism, a condition where the thyroid gland does not produce enough thyroid hormone. Levothyroxine works by supplementing the hormone that the thyroid gland is not producing in sufficient quantities, helping to regulate metabolism, energy levels, and overall bodily function. However, when it comes to the consumption of oats, those on thyroid medication might need to be cautious. The high fiber content in oats, particularly soluble fiber, can pose a challenge when it comes to the absorption of levothyroxine. Levothyroxine needs to be absorbed into the bloodstream to be effective, and it is typically recommended to be taken on an empty stomach, first thing in the morning, with water. The presence of high-fiber foods, such as oats, can bind to the medication and delay its absorption, potentially reducing its effectiveness. This can lead to fluctuations in thyroid hormone levels, which might cause symptoms like fatigue, weight gain, and difficulty concentrating to re-emerge or worsen. Consider the case of Jessica, a 45-year-old woman diagnosed with hypothyroidism. She had been taking levothyroxine successfully for several years and was diligent about her treatment. However, Sarah loved her morning oatmeal and began eating it right after taking her medication. Over time, she started noticing that her energy levels were dropping, and she was gaining weight despite her healthy diet and consistent exercise routine. After consulting with her doctor, they discovered that the timing of her oat consumption was interfering with the absorption of her thyroid medication. The issue Sarah faced is not uncommon. The timing of when you take levothyroxine in relation to eating oats or other high-fiber foods can significantly impact the medication's effectiveness. To avoid this interaction, it's generally recommended to wait at least 30 to 60 minutes after taking levothyroxine before consuming any food, particularly high-fiber foods like oats. Alternatively, some individuals may find it helpful to take their thyroid medication before bed, provided it's been several hours since their last meal. Number 5. Digoxin. Digoxin is a powerful heart medication, often prescribed to treat various heart conditions, such as atrial fibrillation and heart failure. It works by increasing the force of your heart's contractions, thereby improving blood circulation and helping your heart function more efficiently. However, the effectiveness and safety of digoxin are highly sensitive to fluctuations in your body's potassium and magnesium levels. This is where oats can play an unexpected role, making it essential to understand the potential interactions. Oats are well known for their high fiber content, particularly soluble fiber like beta-glucan, which is fantastic for lowering cholesterol and promoting digestive health. However, this same fiber can interfere with the absorption of digoxin in your digestive tract. When you consume oats, the fiber can bind to the digoxin, reducing the amount of the medication that actually gets absorbed into your bloodstream. This can lead to lower levels of the drug in your system, potentially making it less effective. Consider the case of Simon, a 67-year-old man diagnosed with atrial fibrillation. His doctor prescribed digoxin to help manage his heart rhythm. Simon, being health-conscious, decided to incorporate more oats into his diet to lower his cholesterol and improve his overall health. However, after a few weeks, Simon noticed that he was feeling more fatigued and his heart palpitations were becoming more frequent. After a visit to his doctor, they discovered that his digoxin levels were lower than expected, despite taking the medication as prescribed. It turned out that Simon's increased oat consumption was interfering with the absorption of his medication. If you are on digoxin, it's crucial to manage your oat intake carefully. You don't necessarily need to eliminate oats from your diet, but timing can make a big difference. It's advisable to take your digoxin dose at least a few hours before or after eating oats or other high-fiber foods to minimize the risk of reduced absorption. Always consult with your healthcare provider to tailor a plan that works best for your specific situation. While oats are celebrated for their numerous health benefits, they can present challenges for individuals on certain medications. Understanding these interactions is crucial for managing your health effectively and avoiding potential complications. By staying informed about how oats can interact with these medications, you can make better choices about your diet and medication regimen. Always consult with your healthcare provider before making any significant changes to your diet, especially if you are on medication. They can offer personalized advice to ensure that both your dietary choices and medications work in harmony to support your health. We hope this video has provided valuable insights into how to navigate the complexities of food and medication interactions. If you found this information helpful, please consider subscribing to our channel for more health tips and advice. Your well-being is our priority, and staying informed is key to maintaining a balanced and healthy lifestyle. Thank you for watching, and we look forward to bringing you more valuable content to help you live your healthiest life.